Everybody, welcome.
Agradecemos toda
We
su
are
asistencia el día de hoy
very
en
grateful for
este
your
tercer día.
participation.
Hoy el día va a estar conducido por
Today,
mi colega Andrea Villalobos.
my colleague
Andrea es
Andrea
oficial
Villalobos
técnica del
will
equipo de la Unidad
be
de Gestión de Amenazas
directing
Infecciosas del
this
Departamento
webinar,
de Salud.
and
Yo
she
estaré
works in
todavía
our division.
apoyando
I will
en
be supporting her
ciertos puntos del webinar. Nada más
in
para
relation to
presentarme a
several
quienes es su
points of
primer día
the
hoy. Mi
webinar.
nombre es Tania Escamilla y también trabajo en el Departamento de Emergencias
I
de Salud de la Organización
I'm
Panamericana de
Tania
la Salud
Escamilla. I
como
work in
especialista de
the health
comunicación,
department
pero
also.
le quisiera dar el paso a mi
I would
colega
like
Andrea
to
Villalobos,
give
quien
the
los estará
floor to
acompañando el día
Andrea
de hoy.
Villalobos
Andrea,
now.
muchas gracias.
Thank you so much.
Hola Tania, buenos días.
Hello,
Buenos días a todos.
Tanya.
Solo
Good
para
morning,
comentar si
everybody.
vamos a iniciar el proceso de
I
grabación.
just wanted to make sure
Creo
that
que
we're starting
ya
the
se inició.
recording of the
Ok,
webinar.
perfecto.
Yeah,
Entonces,
perfect.
como lo decía Tania, buenos
As
días
Tanya said,
a todos. Este es el
good
tercer y
morning,
último día
everybody.
de
This is the
nuestra
third
serie
and
Preparación y
last
Respuesta
day
a Problemas
of
causados por
the
patógenos respiratorios.
webinar
Concentrados
on
en
the
interpretación de
risk
riesgos.
communication
Recuerden
and
que
community
mostramos una
management.
interpretación simultánea
We
en
have
portugués, en
simultaneous
inglés y en español,
interpretation,
y lo pueden
English into
seleccionar en la
Spanish,
parte inferior de
Spanish
su
into
pantalla.
English, Portuguese into English,
Muchas
English into
gracias a quienes
Portuguese.
han venido trabajando con nosotros el
I
día
would like to
anterior.
thank all of you who have been working with us in this webinar. The first day, we talked about the general elements of risk communication, and we had several exercises to reflect upon all the achievements. And then the second day, we started with Sara Ferraz' presentation, and she talked about the importance of internal communication and coordination in the preparation for the pandemic. Then we had the presentation of Susan Herbert. She's a consultant in the risk communication management at WHO, and she talked about the importance of internal communication and effective risk communication. And then to finish the second day, we had an exercise in the different countries, and then we use a simulated and hypothetical exercise about an infection by a respiratory virus, and the colleagues share their comments. For today, could you please share your screen? Thank you.
Muchas gracias. Iniciaremos con la presentación de Sara Ferraz, consultora del equipo de influenza, quien nos hablará sobre comunicación externa y el desarrollo.
Sara Ferraz will talk about external communication and SOCO, which is the single overarching communication outcome. And then we will continue with Nina Gobat, our colleague Nina Gobat, Technical Officer, Community Preparedness and Resilience Unit, Health Emergencies Program. We'll talk about the behavioral data and its connection to the design of public health messages. And colleague Martha Scherer, Senior Consultant of the Europe Regional Office of WHO. Thank you so much and welcome. And then after the presentation, we will have a question and answer period moderated by Tania Escamilla. And then after that, we will have a discussion, the exercise for today's webinar. This will be an individual exercise. And then after the presentations, we will have that exercise. And finally, Tania Escamilla will give us some closing remarks. So with this, we can begin with our agenda. Thank you so much for your participation. Welcome, all of you. We will begin with your presentation. Sara? Good morning, everyone. You have said something important. Yes, there are some people that are here for the first time. Let me introduce myself. And I am a consultant in the influenza team for risk communication. And I do hope that you will enjoy today's webinar. We will be talking about the continuation of what we started in the last couple of days. We talked about the practical elements for internal communication in risk communication plans. In general terms, there are several elements that we should work on. So definition of stakeholders, the definition of responsibility, definition of coordination, and the definition of the information flow. Hi, could you please mute your microphones, everybody? Thank you. And then let me just make sure that I will adhere to the time. So based on yesterday's activity, we received some comments that we will be working on today about the exercise. And this will be give us a support so that we can have more tangible and more practical exercise. Since we're talking about strategic elements, many times it is difficult to visualize this in practice. So I will give you some examples. So internally, this is what we worked on yesterday. And then now today, we will talk about external communication, the practical elements that we should have in our risk communication plan. What should those practical elements be? First of all, we have the definition of focal points for communication with the main media, TV, journals, telejournals, radios, and so forth. And then this has to be previously set. We cannot wait until we have 1, 2, or 3 cases or an alert to be able to identify those people or those media with whom we will be communicating. The second one is the definition of the strategy for the development of messages. We have the preparation phase, the alert, the announcement of the emergency. We have to maintain this, and then afterwards we have to think of the recovery phase. So as we had during the COVID-19 pandemic, we have to change the messages. After 2 years, we cannot talk about the transmission of COVID-19. But then, so how should I change my message? We have to pay attention to this and to continue to see what changes are in effect. And then, of course, we have to define the mechanism of social listening, as we discussed yesterday. What are the first stages when you have an emergency or an event? So this definition has to be developed beforehand. And then we have to determine how we activate this during the emergency. We have already discussed this. We are participating in this. If we have a mechanism through the social networks or how, the social media. And then, of course, the definition of the frequency of the update of the health situation. These are the main points on which we can work in your communication plan. You have to have a contingency plan, and the basic elements have to have responses. So at the beginning of the COVID-19, everybody has updates, the number of cases, number of deaths, and so forth. As time elapsed, we determined that this daily communication did not have the same effect. So we have to go weekly or depending on what the situation is. So when should we start gathering information in the region? Well, we have to gather information in the region where the cases emerged. If we talk about Fredonia, we cannot really set an alarm in the entire country. If the situation is confined to one region, we should not spread panic and crisis feelings with this. Next one, please. We have 6 recommendations for an efficient and effective risk communication system. We have to really think of the importance of risk communication when the in 2005, the International Health Regulations was implemented. Many of you participated in these exercises. So for many of you, these 6 points will be very clear. Whether you are a coordinator or a communicator, you know how to manage, manage this external communication. The first point is you have to be the first one. Even if you don't have all the answers to an event, for instance, just in the case of Fredonia, we have to be the first ones to mention. We have to say, yes, we are gathering information. We have not confirmed yet. We are studying this, but we have to be the first ones to communicate with the community. The second point is to be correct. You have to make sure that that's the correct information. Many times, the institution prefers to respond to some information, only to say that they don't know. And then when you say that you don't know, that is the best way to set the path for the third point, for credibility. You have to be credible. And this has a lot to do with the recommendations that you will give later on. Then the fourth point is to express empathy. Here, you have to really put yourself in the place, in the situation of the community. Yes, you're concerned, and our role is to show that you're concerned. And then you go to action. The message that you give has to promote actions. And then, with all the information that you have to do that, promote action, and then give them an effective and direct command so that people know how to respond, and then to show respect. These past few days, we know that the political situation around the world, together with the communities that have been affected by disease, we also have a specific political situation. We have to show respect in our information. That is one of the best way to create a good communication system. This is a brief summary about the Fredonia exercise. You have to define a clear and objective message about the real situation, even if you don't have all the answers. And then the first questions, what are the first steps? Somebody in the chat said, well, we have the circumstances that at that moment, we don't have all the information. And then in blue here, this is one of the responses of the countries. The countries have understand what are the first ones for external communication. You have to clarify the situation. You have to calm down and reassure the population. You are telling them what you're doing at the level of the health symptoms. How can the population be protected? What you know up to now. And then more important than anything else, what you're doing to contain that disease. So in today's presentation, we will emphasize what can the population do. And at the end, this should be the objective of your message. You give guidelines to the population, preventive measures, what to do. So this is another example. Here, the country was very concerned about internal organization, and I like that. I like that because I wanted just to show you the 2 points here: to define your spokesperson and to train them. The spokesperson should be trained and defined, and then you have to develop community participation plans with the different systems of alert to be able to activate what you have already planned for. The others are stages that you can apply to this exercise, but then it all depends on the situation of each country. And you have some guidelines here for all the situations. For all kinds of situations, what does the population have to remember? What should we avoid in these communications? And then you have to train this so that you have a positive approach. How can you turn something negative into something positive? You have to change this towards the positive. We have very interesting examples in which trained personnel can ask a question, and this question in a way is like a trap, but that can change really. And then we have to train with the SOCO, which is a single overarching communication outcome in our communication. What do we want to change with the message? With the message that we will be broadcasting, exactly what type of change should we generate? Do I send a report? The population should be able to understand that report. What is the expected result from my communication? So that is SOCO. So even if you don't work directly with communication, with epidemiologists, with lab technicians, with directors, everybody should understand that this logical approach is the one that could work, because you are also part of this communication system. You broadcast technical information, but the type of communication has to be the best type that will have the best effect. So we have all the people in the chain who understand the way to prepare an objective message. And so that is what we will be working on. So if you consider SOCO, you have to think of the important aspects, and I would like to understand that SOCO is a method that allows us to determine what changes do I want to introduce. It's not magic. We have to think ahead of time. So we have to work in communication so that we target the people, but we have to tell the people what they have to do. Well, that doesn't always work. We have to involve the people. Involving the people is more effective. And then here, people say, why do you want to create trust in the community? That's the role of the health professional. Yes, but first, this is part of the routine. The community is part of the routine. During the COVID-19 pandemic, we were not used to have communication with the community. All that communication was institutional. But then we had to establish a relationship during this pandemic in which we could listen to the communities. So if we establish communication with the community as a routine, we implement sustainable mechanisms within the health systems themselves for feedback and social listening, then we will have the support to establish and gain trust, and then the community will listen to us. So this is a simple study as to how people retain more information. I realize that when we read, listen, and do something, we retain more than when we just listen and see and listen or just read. Why? Because the change in behavior has a lot to do not only with the message itself, but the way in which we retain information, how we will apply this to the communities. So we will get the support of the communities when the community understands and they help us in their own way. So this is something very common among us, those of us who are scientists and experts in general. We bring all of this evidence, all of this information to the table, of the arguments, so that we develop the main message. And then this sometimes creates a challenge with the community. So today, the message, the main message is the first thing. And then we will be explaining this. And so these are the strategy for an effective community participation. The first thing is to help to create a receptive state. You ask the community what they would like to know about the vaccines, about the health event. You try to listen to what the community say, and you do not rush them so that you can have answers. You create other communication channels. Today, we're focusing on the social media, but then we can think of other things. For instance, community radio system, just talking to the community where you live, health communities, and then to create mechanisms for listening to this population. So this listening mechanisms and updating the community when possible, we're talking about the national level, but also we could go to the local level. This is an idea that we could spread. If I have information in a unit as to how the situation, the health situation is in my community, it is easier to consider this as a routine mechanism, and I could practice that and I could include that in my communication. I know that when I want to get information in my community, I can go there, and that happens in the small towns, and the direct relationship with the health personnel is very valuable. So last but not least, we have to listen first. What are the perceptions? What are the concerns? And so in the exercise, we ask to develop messages that respond some questions, and then to share with the community and to make sure that the messages are clear and if changes are necessary. So we are just testing this, we're adapting these messages just to make sure that we work proficiently with the community. And now we were going to talk specifically about the SOCO. We're going to develop the SOCO to change behaviors. What is SOCO? SOCO is the change that I want to generate. So we're going to respond to some questions. This will lead us to the main message. Many times we want to say that it's important to use masks, but then we have too much information. We have to think of some questions that will lead us to the main object. Ask, what is your problem? Oh, my problem is that people don't want to wear masks anymore because they think there's no more COVID-19. Why do you want to focus on this problem? Why is it a problem? Well, this may be a problem for us because at the same time, we think here in Brazil, for instance, people do not think that COVID-19 is a problem because we already have vaccines. So why now? Why? Well, because I just think that COVID-19 is just like a flu, and you don't need so many precautions. So as people respond to these questions, then you generate something that could be effective in your message. Who needs to change their behavior? Is there a public objective? So when Tanya presents the exercise, you will see that some of the questions involve the primary and secondary audience. What is the target audience? The target audience or the primary is the Fredonia, and then the secondary audience is the entire country. And it may be that we do not reach the outcome desired because at the point in time that we were trying to define, we did not define the target audience. So you have to think of the target audience, the affected population, and then as we go along in the questions, we will increase our scope. And then what change or result do you want to see as a consequence of this communication? What we need now is to make sure that the community goes back to using and wearing the masks. And then, they have to cover their nose and their mouth. Many people here in Brazil wear the mask, but cover only their mouth and not the nose. So they have to know how to use it, how to wear it correctly. So this is a challenge. And so we have to think of the message that we have to direct to these people, because for the past 2 years, they have been hearing, wear your mask, wear your mask. So what should we consider when we are responding to these questions to develop your message? First of all, you have to think from the perspective of your audience. If they are a primary or secondary audience. Because if I am talking to people in a risk situation, then the message has to be a specific message. The second one, you have to have something realistic and something that is doable. You have to, for instance, talk about the alcohol disinfectant gel. Many people do not have access to water and they cannot wash their hands. So that's an example. And the third one, you have to think of the main point of your communication message. We're talking about the need to wear the mask. At this moment, you do not have to mention other aspects or enclosed environments or too many people. You just have to center on the mask.
Generar con tu mensaje solo se define después de
Lastly, the SOCO, the message can only be defined after you have identified your audience and profile. So for the exercise, I'd like to offer you some ideas that have to do with behavioral change. First, avoid using overly technical terminology. In the health sector, we use terms that we're familiar with: suspected cases, fatalities. And these are terms that the general audience may not be familiar with. It was a struggle. In some places, we were speaking of cases, and cases doesn't mean much to the public. Each case is a person. So in some situations, we had to adapt the messages to make it more relatable for people for messages to resonate with the audience. Then also avoid communication based on fear, sensationalist photos, bodies, hospitals that were not able to receive patients. And it was important to avoid using fear as a vehicle. Third, negative messages. Avoid messages that are negative in nature, that use no. Do not go to places that are crowded. Do not go to closed places. This can be changed by making it possible instead of positive. Instead of saying do not, use do or avoid. So I think it's important for the messages to be direct. And then lastly, remember that the information has to do with individuals' time and place. You need to specify what can be done or what is being done. This may sound awkward, but often what happens when we are communicating should be community focused, because that is what people are looking at. They're listening to their community, not so much to the health authorities. And thirdly, we're going back. Don't make any commitments before first agreeing with the authorities, and engage local media. Promote action. Again, during the exercise, you will be working on a message. It should have a clear and objective action at the end. Fifth, reinforce positive behavior. And lastly, you do have a key role to play in health communication. Health communication, well, health practitioners should be trained in this, whether it's epidemiologists working in the lab, whether you're a communication specialist. We all need to be equipped for this, because it is what is going to support us in our work with communities. And that ends my presentation. Thank you very much. Sarah, thank you so much for an excellent presentation and for connecting days 1, 2, and 3, showing us how important it is to connect internal and external communication. I very much liked your message about focusing on the audience and the profile. I think that is key. Now we welcome our next speaker.
Are you here?
Hi, everybody. Yes, I'm here.
Okay, great. It's your time. Thank you so much again. And please go ahead. Thank you.
Thanks very much, Andrea. And good morning, everybody. It is my absolute pleasure to be joining your webinar series. And I will be, in my presentation, building out a little bit more from what Sarah was presenting now in terms of the messages, and thinking a little bit more about what happens in that space in between when people receive the messages and we want to try to influence change. And in particular, I'm going to be calling attention to the importance of using behavioral science, to be using data, and to be using theories and technologies that can help us think about human behavior and the complexities of human behavior, so that risk communication, community engagement practices can really engage with this complexity and move towards encouraging particular kinds of behaviors that will support the end of public health emergencies. So I'm going to cover three things. The first is around why it's important to think about social and behavioral aspects of emergencies. And I'm really going to take a step back and think about that quite broadly. Second of all, I'm going to touch on the global trends and developments that are moving us more and more in this direction. And third, I'm going to point to a few ways in which we can use the tools and technologies of behavioral science and data to drive strong risk communication, community engagement practices in health emergencies. So these images are all media reports from COVID-19, and they really illustrate so clearly the reality that health emergencies are social events as much as they are biomedical. And this is the nature of the challenge that's in front of us in managing a health crisis. Thinking about human behavior and social aspects is not new. It's part of health emergencies. It always has been part of health emergencies. And unless we pay attention to these social dynamics and these behavioral dynamics and ask the right questions and collect the right information and critically collect data around these aspects, they go unseen. And then when we develop interventions and policies and practices, we develop ones that are not going to work because they're not based on a full and holistic assessment of the problem. So a key challenge for us is that we are working in a space of incredible diversity and complexity when it comes to human behavior. People see the world differently. They make sense of things differently. They have different cultural orientations. They behave differently individually to how they might behave in particular groups. They move across different social groups. They have different kinds of resources that are available to them. And so what we are trying to do with health crises is bring people together and create cooperation and get people to work together in a time of crisis, a time of difficulty. And this working together, this cooperation needs to happen at very local levels, right the way up to national levels, to regional level, as well as to global policy levels. Now, fortunately, we have the scientific tools and frames of reference that can help us think about this complexity and think about human behavior in a way that can allow for greater cooperation, which is what we're needing in the face of a health crisis, because emergencies bring out the best and the worst in people. You will remember, for example, the rush to stockpile essential supplies at the start of COVID-19 amid fears that these were going to run out. And we have all had a lot of experience with the reactance and the pushback around some public health policies related to social distancing, use of masks, that very often fall along ideological or political lines. But we've also seen the flip side. We've seen strong and humane community leadership. We've seen acts of solidarity. We've seen people working together to support each other. We've seen feats of human courage and bravery, for example, in our health workforce. And so a key question for us is, how do we communicate? How do we use the tools and technologies available to us, the science that's available to us, to call for this more pro-social cooperative behavior that is so critically needed in public health emergencies? So these are actually artworks of very small photographs that all together make up these images, and a beautiful sort of illustration really of what's needed. Many, many, many people coming together to cooperate to make to find solutions to tackling these crises. Some of the global strategic frameworks and initiatives are really underpinning this more sort of integrated perspective around risk communication and community engagement. And I know that on the first day you would have heard about this framework, the Director General's 10 proposals to make the world a safer place, looking at new models, new ways of thinking about risk communication, community engagement, with a strong focus on community-centeredness and building resilience. There's also a very strong emphasis in these frameworks for the need for data to drive action. There's also recently been a resolution that's now been passed by the WHO Executive Board on behavioral sciences for better health, and that's calling for stronger evidence and stronger application of behavioral science in informing health policies and strengthening practice. So there's clear global momentum for this area of work, and it's really for all of us who've worked through COVID-19, it is self-evident. The question is how? How do we use behavioral sciences? How do we use the tools and the technologies that are available to us to strengthen risk communication practices going forward? So I'm going to point to just one or two thoughts here. This is a very big topic. I think this is the key challenge ahead of all of us. And I know that Martha, in her presentation, Martha will be speaking after me, will give some really excellent examples of and practical examples of how this was done for COVID-19. So I'm going to point to some very high level areas that can help you start to think about this area of work. I would say that there's three broad areas that behavioral data can be useful, and it's important to distinguish between the three. The first is to think, what will you use your data for? Are you looking to gather data to better understand a problem, to better understand what's needed, so that you can more specifically target your interventions? The kinds of questions some of these Sarah spoke to in her presentation earlier, questions like in any new situation, how are people making sense of it? You know, what are they doing to protect themselves? What do they know to do to protect themselves? How do they perceive their level of risk? You know, where are they getting their information from? Who do they trust? These are all important questions. And this is where we need data to drive our understanding of these problems, understanding of these issues, so that we can better target some of the interventions. Be they communication interventions, be they more sort of local-led community interventions, be they you know, training interventions, whatever they may be, data to help you better understand and diagnose the issue is critically important. The second piece where behavioral science data and frameworks and theories can help is in co-developing solutions and interventions. And here it really helps to think backwards, and Sarah made some very good points about thinking specifically about the behavior that you want to change. And as you sort of work backwards, then once you've got a very clear sense of your outcome in terms of framed as a behavior, you can then look to co-develop how does that intervention look, and the theories and frameworks that you can use to help you identify more precisely what should go into those interventions. Again, whether that intervention is a message, whether the intervention is a poster, whether it is more a two-way dialogue facilitator that's happening in the community, whatever that intervention may be. And then the third area to look at and to use behavioral sciences is in assessing how well any solutions or interventions are working. And this is often an overlooked step. It's the piece around implementation science, looking to see what is the impact, how does this intervention work, and what are some of the intended impacts, and what are some of the unintended impacts. And gathering data around those will help you, of course, improve and refine your interventions going forward. So 3 broad areas where behavioral sciences can help. In terms of how you then use your behavioral sciences to achieve these ends, there's many different methods that are available to you. There's quantitative, qualitative methods. Very often these can be combined into mixed methods. And there's also been a lot of methodological innovation that's happened through COVID-19 in being able to do some of this work very quickly, as well as being able to do some of this work remotely. So many, many good ideas that we can draw from. So this is a really exciting and dynamic area of work. And I think that what we're seeing now, particularly after COVID-19, is that it's becoming much more systematic. It's becoming more rigorous and much more professional. And it's really highlighting the technical skill and expertise that's needed to do this well. So in closing my talk, I'm going to leave you with these 2 questions just for your reflection. And I know that when you listen to Martha's presentation, you will get a lot of good ideas of, you know, how you might start to answer some of these questions. The first is, what do you need in your area of work to be able to access and use behavioral data that can then inform action? And my second question is, what can you be doing now to make sure that in the next health emergency, you have the tools and technologies available to you to be able to really use the science to achieve the outcomes of strengthened risk communication and community engagement practice. So with that, I'm going to close my talk and hand over to Martha. Thanks very much.
Thank you very much, Nina, for that great presentation. And it does lead in so nicely to what I plan to share. So I just need to get my screen organized. All right, can everyone see the presentation in full mode? Okay, great, thank you. So my name is Martha Scherzer. I am a senior consultant in the WHO Regional Office for Europe, and I work as part of the Behavioral and Cultural Insights Unit. And I will explain to you a bit more what that means. And what I would like to talk to you about today is using these kind of insights that Nina really just described so nicely to tailor your emergency response. So, but let me start first with some definitions. I know that you are hearing a lot of terms today that may be new for you. They may also be things that can be defined in different ways. Sometimes we use different words for the same thing. So I just want to be clear, in the European Regional Office for WHO, we understand behavioral and cultural insights to be the systematic effort to collect insights into the context and individual factors that affect health behavior. And then very importantly, using these kind of insights in the design, development, implementation, and evaluation of a whole range of things, not only communication, but policies, services, as well as communication, with the intention of really improving health and well-being and reducing inequity. So that's how we understand the topic. Just very quickly, in the regional office in Europe, we have this unit now that focuses on this area of work. It's one of 4 flagships. We recently passed a resolution and action framework that was actually just in advance of the global resolution that Nina mentioned. So there really is momentum around this kind of work. We have a particular approach that we call tailoring health programs. You can see the cover of the approach that we are in the process of revising right now. So that will be available in the next few weeks, and I'm happy to share that with you. We do work on both emergencies and non-emergencies in this unit. Yes.
Excuse me. Hello, Marta. It's Andrea from PAHO. Could you please put your presentation in presentation?
Oh, I'm sorry. To me, it looks like it is. Okay, let me share again. Actually.
Marta, you have to go to the one that is like close to the minus, like the minus and the plus. Down below. Yes,
Yeah.
that one. Perfect.
Yeah.
Oh no, it's not.
No, on the top.
You slideshow.
So
Yes.
yes,
Perfect.
thank you so much.
I'm
Thank
so
you,
sorry.
Marta.
Sorry, to me it looked like it was in
It's okay.
full
Thank
screen.
you.
Okay, sorry. So just to say, our unit works on both emergencies and non-emergencies. But I will talk to you today about some specific examples around the COVID-19 work that we did, and then also a little bit about the situation, the war in Ukraine, and some work we're doing with refugees there as some concrete examples. So starting with COVID-19, we developed quantitative surveys to collect some of this data in the way that Nina was mentioning. So we developed a standard protocol and questionnaire that could be adapted to different country situations. This is quantitative, as I mentioned, cross-sectional surveys. So that means it was a snapshot, sort of just a picture in time with different participants each time we collected data. So there were multiple rounds of data collection in many countries. Each time about 1,000 people were included in data collection, and this group was representative at the national level for age, sex, and geographical distribution. There was ethical approval provided for all of these at the national level, and where we worked directly with countries, there was WHO ethical approval as well. It was quite a long, complex kind of questionnaire, including variables related to behaviors, perceptions, well-being, demographics, and other things. Data was collected in some cases by telephone with telephone or computer-assisted telephone interviews, or self-administered online, or a combination of both. And over time, from 2020, March, April 2020, until just last year, about 30 countries out of 53 in our region had used this tool. We worked very closely with about 18 of those countries to adapt the surveys and to help collect and analyze the data. And so this means that we heard from well over 120,000 individual people throughout the pandemic in all these different countries from their own perspectives through the quantitative survey, but we were really able to hear from these people. And we developed a community of practice where researchers and people working kind of technically on these surveys could come together and share some of their findings, but also some questions and issues that were coming up. And just for your information, we have just started a process evaluation of this whole approach overall that we're hoping we'll have some results on later this year that can really help to inform suggestions, recommendations for how to do this similar kind of work in future emergencies. So I am going to go through sort of a combination of a little bit of findings from our data, but then I'll focus mostly on examples of how countries were able to use the data in a number of different ways. So one topic we focused on, I'm sure everyone in this group understands well health literacy and how important it is. And we consider health literacy really that ability that people have to find, understand, and use health information. And we know from our data, it clearly showed that people with higher health literacy also had higher vaccine intentions. So they said they were more likely to say they wanted to get vaccinated. They were more likely to follow other recommended public health and social measures. They were more likely to report they had better well-being overall and a more positive emotional state. And they also reported greater trust in health professionals. So just clear evidence of how important health literacy is. And this is something that it's not only dependent on an individual to sort of increase their own literacy. It's really for us to ensure that the kind of information we're sharing with people is easy to find, easy to understand, and really easy to act upon. And I know Sarah really focused on that in her presentation as well. So I will now give you some examples of how countries use data they had collected to create some communication activities. So in Georgia, which is a country in the Caucasus region, early in their data collection, the first maybe 2 rounds of data, they found that some of the ethnic minorities in specific regions of the country did not have the same level of understanding. Their risk perception was much lower. And they learned also these people were using different media channels. And it really provided clear evidence that these ethnic minorities needed information in their own languages, local languages, using more local channels. And this evidence really helped to motivate the government and provided a good motivation to create targeted interventions for these specific populations. You can see in the photograph, posters were created in local languages and were displayed in areas where people would see them locally. The government and the WHO office there also worked with local kind of influencers, local celebrities to work with them as spokespeople as well, again, in those local languages, really drawing on priorities of the local populations. In Moldova in Eastern Europe, we also found, this is related to vaccination as well for COVID, data showed that younger people were really repeatedly saying they were less likely to want to get vaccinated. And so the government and the WHO office there really wanted to focus on working with younger people. So they engaged with universities and the Association of Medical Students and Residents to work on a peer kind of campaign. So medical students reached out to their fellow students and other university-age students. They created a campaign that went out largely through social media. You can see here, again, based on a lot of the information they collected, and then focused efforts as well on taking the vaccination to universities where young people could easily access the service. So again, tailoring the communications and following all the way through to action and making it easy to act on the information available. Another example is in Kosovo, where they found that, in fact, sort of early when the vaccine was available in Kosovo, quite a lot of people said they were willing to get vaccinated, but they still had a lot of questions around it. So they were not absolutely against vaccination, but wanted to know more and had some concerns about side effects in particular. And there, the WHO office and the Institute of Public Health worked together with other donors and identified some Olympians. They're Kosovan Olympians, obviously very strong, very healthy, and they were willing to do this series of videos to promote vaccination, and that they had all been vaccinated and they continued to be healthy and strong. So another good example of tailoring the information provided using the evidence that was collected at the national level there. Another topic that we know is extremely important is trust, and that's trust in the government generally and other kinds of institutions. Our data clearly show that people who trust more are more likely to follow recommended behaviors. The kind of data we collected allows for an analysis of looking at the demographics, some of the other characteristics of who are the people who trust or don't trust those institutions. That data, of course, is very specific to a country level, so is more useful to look at country by country. But I want to share an example of how one country, Slovenia, found that they could combine the fact that they had collected this kind of behavioral insights data with an overall kind of transparency strategy that they were embarking on to build trust in the government overall and the Institute of Public Health in particular. So they took the results from the data that they were collecting quite regularly and created a public dashboard that you can see here that showed, in particular, the uptake of vaccination. And they have this, what they called this speedometer down here in the lower left corner, and people would check it regularly. It was being used almost daily in the media at sort of the peak time of vaccines becoming available there. And this was a way that the government could show they were collecting data, they were sharing it publicly, people could look for themselves and see how the situation was changing and use that for their own decision-making and see how the government was making decisions as well. So this kind of data, there are many different levels in which it can help to strengthen trust. Another area I just want to mention also is around protective behaviors, the public health and social measures that have been so important throughout the pandemic. As an example, in Denmark in 2020, there was very heated discussion about whether to bring in a mandate for wearing masks, and they really held off for a long time before bringing that in. There was some concern that if there was a mandate for wearing masks, people might wear masks, but then they would stop doing other of the behaviors. So that was a big concern. And then there was data available from Germany and some in Denmark that showed when Germany had brought in a mask mandate, not only did the use of masks increase significantly, but then the use of other of the protective behaviors also increased. So with this kind of very clear data, the Danish government then felt much more confident in bringing in a mask mandate. And later that year, in August of 2020, they brought in the first mask mandate for use in public transportation. So there's a link here to an article that was published with that data. So you can take a look at that for yourselves. I'm going to go on next to the situation in Ukraine, where we're collecting a different kind of data, and give you some examples from a qualitative study that we're doing there and how that data can be used as well. Again, so when the war started just about a year ago in Ukraine, we thought it would be very important to understand from the perspective of the refugees what their experience of accessing healthcare would be like. Neighboring countries opened borders and offered a lot of services, but that experience of actually using the services would be very important to understand. And for this, because we did not know the range of experiences, we weren't even sure what to ask people as part of a survey. And this is an excellent situation where you can use qualitative research that asks very open-ended questions so you can understand more of what's happening and you get a lot more detail this way. So we designed this research with to use in-depth interviews, and we talked to people at one time point and then followed up again 3 months later to see if anything had changed. We're working with a Ukrainian research company to conduct these interviews online. And through the sampling that we do, we are looking at a diverse group of people by age, location in the host country, the type of accommodation they're staying in, education level, and whether they're taking care of other people or they're on their own. So we see some similar issues and a few differences. We are still in the process really of sharing these results and working closely with governments to integrate the findings into the response. So I will give you, and this is an overview that you can take a look at and read for yourselves, but as an indication of the kind of data we get from qualitative research, you can see that there's a lot of detail. We know, for instance, that the referral system within the healthcare system in host countries can be confusing for people. There are long wait times that can be frustrating. Prescription medications are a big issue because the process even of getting the prescription and how pharmacies work is quite different than it is in Ukraine. We're finding dentistry is something that's very expensive and people have quite a lot of issues with that. Whereas quantitative data and conducting a survey might tell you, for example, that majority of the refugees are women, and maybe you would know that many of those women have children with them. The kind of qualitative research that we've done in this case helps us really understand that many of those women, even most of the women, are alone taking care of their children. They don't have their normal social circle with them that they would have at home. So there's a real added burden. Finding childcare can really be very challenging, and then they don't feel able to access healthcare for themselves or some of the other services that are available to them because no one is available to watch their children. So that kind of detail and experience is something you can really only get from qualitative data. And it helps us advise governments that they could consider added support or encouraging support at a local level for childcare options, for example. So I will just share some examples of how we've worked with this data in one of the countries to translate some findings into action. So we found that, again, information was a big issue, especially early on in this situation. Many of the refugees were saying they didn't have enough information, they didn't know where to access it, they didn't understand how the health systems worked. So we had some recommendations, possible actions that the government could take that we discussed with the key authorities around information. Also looking at finding some ways to incorporate trained health workers from Ukraine who could perhaps be involved, even if they couldn't be employed as health workers, perhaps even as mediators or people to help kind of navigate the system. And then in Romania in particular, the government, again, this kind of evidence really helped move forward some of the ideas that they might have had already or things that they were working on There is now support for health mediators at a county level in multiple locations. There's work being done on a video to help really explain and share among Ukrainian refugees how the health system works in a visual kind of way. Also highlighting the positive findings from the study to just make sure health workers understand that their work is really appreciated, and volunteers who were identified as being so helpful also know that that there is this overall sort of gratitude. It can really help ease the situation overall. And then some intercultural sensitivity training for the GPs was also identified and is moving forward just to help them in the interaction with people from Ukraine who have been through such a difficult time. And we are still working on final reports for some of these things, but we have an article that's available on the website with a link I've provided here. You can read a little bit more about the overall situation in Romania and how this data has been used. So that's the main part of my presentation. I just want to say that we do have some tools available that we're happy to share. I mentioned at the beginning, we are in the process of doing an evaluation, and we will share findings from that widely, hopefully with recommendations and some tools for how to move forward. We also have more information on the Ukrainian research that we're doing and the tailoring health programs. So I'm happy to share all of these things in the future. And just to say, we are still a relatively small unit. We do a lot of really interesting work, and all of the work I've presented here, of course, requires lots of people to support that. And if you have more specific questions beyond our Q&A today, please do reach out, and I'd be happy to engage in some conversation. Thanks.
Okay, thank you very much, Joanna and Marta. Really very interesting presentations. Nina, tú nos comenzaste a hacer como reflexionar sobre la importancia de contar con datos importantes.
Nina, you made us reflect about the importance of having clear data for the decision maker. That was a key message in your presentation, and the importance of communication based on human behaviors, which are different and complex, that identifies us as individuals and as members of groups. And then, of course, all the experiences that Marta mentioned, to have a communication in multicultural spaces is really very important, especially to determine the resilience of the community, and also during this research with a qualitative framework. Thank you so much for your presentations. And now we will open the question and answer period. I don't know if you have any questions in the chat. Tania, I don't see you here.
Gracias, Andrea.
Thank you,
tenemos
Andrea.
una pregunta en el
We
Q&A.
have a question in the Q&A.
Creo que tanto Marta
I
como
think
Nina de pronto
Marta
podrían
and Nina
ayudar
perhaps could answer
a
this.
contestar. Y se las dejo a las dos a ver cuál de las dos se anima a
Well, I
contestar
don't know if
esta
either one
pregunta.
of you would like to answer
Es una
this.
pregunta de un colega de Costa Rica
He's a colleague from
que
Costa
dice,
Rica
hay un mecanismo
who asks, is
eficaz
there an
para
effective
demostrar
mechanism to
empatía
demonstrate empathy
y o
and
incertidumbre sin
uncertainty
producir un efecto
without
alarmista y sin
alarming the
aparentar falta de
population
capacidad?
and without showing lack of
Eso nos
capabilities?
preguntan desde Costa
That
Rica.
is a
Está más
question from
relacionado
Costa Rica.
obviamente con
So this
temas de
is
comunicación externa y
related
vocería,
to
pero me encantaría
communication,
saber si de
but I
pronto
would
Nina o
like to
Marta
know
tienen
if either Nina or Marta could
alguna
answer this
reacción
question
con
or
su
could react to
experiencia
this
a esta
question
pregunta.
based on your experience.
Marta, do you want to go?
Sure, I can say a little bit. I mean, it's an excellent question, and I think it is really one of the key issues in all emergency and outbreak situations. We want to make sure that people really have an appropriate level of risk perception and an appropriate kind of understanding and concern. So you don't want people to panic, but you also don't want them to think that they're safe if they're not. So it's very tricky. I would say, of course, that having data related to this can be really helpful, and understanding the level of risk perception is can really contribute, I think, in an important way. With these different waves of the COVID surveys that we did, we could see how risk perception was sometimes going up, sometimes going down, and it was not always in line with what was really happening in the country in terms of their COVID numbers and, you know, increasing infection rates. So I think having that kind of data can be very helpful, so that, you know, if risk perception is going down, people are thinking that they're fine, but the number of cases is really climbing dramatically, that you can call attention to that also, that even through these studies that, you know, or through the epidemiology also, you can see that cases are increasing, and kind of work that into the communication that you're doing. So it is evidence-based, and pointing to a very specific situation. So not just raising alarm generally, but saying where we are right now, we're seeing increasing cases. Therefore, now is the time to be more vigilant, follow the recommended behaviors more closely.
Thank you very much, Martha. Nina, you have anything to add?
No, I think it's a great question, and I think building on Martha's reflections, I agree on the importance of gathering data around this. But I think there's also something about sort of thinking about, I think this picks up on what Sarah was talking about. Where are you pitching your messages? So are you thinking about you know, very local level conversations that might be happening in groups, for example, versus, you know, communication messages that might be coming through the media, or communication messages that might be written on a poster. So all of the different, your media of communication and the levels at which you're communicating is going to play an important role around the way in which you communicate around uncertainty and the extent to which you can demonstrate empathy. And I would say that in the more local you get, and the more sort of two-way dynamic communication you get, the stronger the role of empathy. I think it's tougher, although it's possible, of course, still to illustrate empathy through one-way communication. And I think the trust is so fundamental to this, because if you can demonstrate clear, consistent messaging, even in a time of tremendous amount of uncertainty, you then engender trust. And that is one of the things that I think can really help. I worry about sort of using the idea of panic and disaster too much, because I think it doesn't always necessarily translate to panic and disaster. And so I hesitate a little bit around that. But I think focusing on the things that you want to create, trust, clarity, even within the uncertainty, I think those are absolutely critical principles to work with. Thanks.
Can I follow up to that? Yeah, thanks for that, Nina. Yeah, I would say also that in communicating uncertainty, it's probably one of the most important things that can be done, really, in terms of just really being very clear with what you know, what you don't know, and what is being done to find out more and to learn more, and to really acknowledge, even with what you know, that the situation is changing rapidly, to really just be very clear with all of these things from the beginning, because we've seen so many examples of authorities sort of making a statement that seemed to be true and was true at the time, but the situation was changing so quickly with COVID that people then might have thought, might have lost trust because they felt like they had not been told the right thing. So I think really that being very open with what is not known, and what's being done to learn more is important as well.
Thank you very much, Marta. And that's something that we saw during the COVID pandemic, maybe not at the beginning where there was so much uncertainty because it was, of course, an unknown virus and unknown disease. But afterwards, I think many national authorities and spokespersons at the national level were very empathetic of saying, we know this right now, and we do not know this. And I think that's very key. We also have a contribution in the chat from another colleague, from John Ayana, and he says, I think having templates for messages would provide enormous help when preparing empathetic kind of communication. And I think I agree with that. We need to have something already created. And given that we can have, because we keep repeating this, it is no longer a question if we are going to have another pandemic, and talking about respiratory diseases particularly, it's when it's going to happen. I think we need to be prepared and start working on these type of communications and communicating uncertainty, communicating with honesty, with clarity, which are, of course, the fundamental principles of risk communication, and having those even rehearsals and simulation exercises really help. And of course, having templates and messages. So thank you very much. I really agree with that. And we have another question from Mexico. Y quisiera, I'm gonna start switching to Spanish.
We have a question from
Quisiera
Mexico.
saber si
I would like to
también,
know
Marta o Nina nos pueden,
if
o de
Marta or
pronto
Nina
Sara quiere
can tell
quiere
us,
aportar esta pregunta, pero la pregunta desde
or Sara
México dice,
comes from Mexico,
¿cuáles podrían ser las
which
mejores
could be
formas de
the
escuchar
best
primero
ways to
las
listen
preocupaciones
first to
y
the
percepciones
concerns
de la
and
población
perceptions of the
desde un
population
nivel nacional,
from
o
a
sea, desde el
national
nivel de la
level,
Autoridad
from
Nacional
the
de Salud?
level of the national health authorities? Yes, I would like
Adelante,
to
Sara.
comment on that. During a public health emergency, our great challenge is that we have to have a fast response and have practical activities. So one of the examples that works, and in some countries we have been working like this, is to take advantage of the ports of entry or the ways of entry, the gateways, to learn and to know what mechanisms are available. For instance, if you have forms for reporting epidemiological surveillance, and then we include one or two questions related to the health event, and then very rapidly we are able to have information on the perception of the people. We start in the hospitals, the health centers, and other mechanisms that have been established. You have already established mechanisms for information collection, and then they go to the central level. When we talk about the local level, things are easier. At the federal level, at the national level, there is a higher complexity. So we have to take advantage of the mechanisms, especially the surveillance mechanisms, because they are already established there, and they are there at the health service level. Another strategy would be to define what we do for surveillance. We go to sentinel hospitals where we can start, and that is where we have the largest number of admissions of people who are symptomatic, which is the region in which we have cases, to begin there. And then we double our efforts to reinforce our work. And then we begin in the sentinel units to collect the information. We do not have new forms because the implementation will take time and the information will never reach there. But we will have to take advantage of the mechanisms already in existence and take advantage of what the work that is being done in those health situations and health centers. And that is what we have done. And in practice, this has worked well. My exercise and my recommendation is that you take advantage of what you have, you evaluate, and that is what gives us a sustainability situation. Many times the situation does not allow us to inform or to create anything new. We have to take advantage of what we already have to get a response, because it will take more time. For instance, you have hotlines, emergency lines that are existent for some things, and you can take advantage of those to include other questions, and then you can obtain information. So that's really a good example. The emergency lines really have been useful. You have to map what you have in the country, and then we can work together. We can have intersectoral collaboration, and then we have good results. Thank you so much.
Muchas gracias, Sara.
Thank you so much, Sara.
Tenemos otra pregunta
We have
relacionada
another
al tema de
question
mecanismos eficientes
related
para
to
captar datos. Esta viene de Costa
efficient
Rica
mechanisms.
y
This is from
preguntan,
Costa
¿han
Rica.
usado mecanismos
And they say, have you
eficientes
used
para
efficient
captar datos
mechanisms
de redes
to
sociales como
capture
Facebook?
data from the social
Durante la
media such as
pandemia
Facebook?
vimos que
During the
las redes
pandemic,
sociales
we
pueden
saw
convertirse en
that
verdaderas
social
pesadillas y
media
obstáculos a
became
una
a
comunicación de
nightmare and an
riesgos
obstacle for
basada en
communication
evidencia.
of risks
Maybe
based
Martha,
on
you want to go
evidence.
ahead with this one, please.
Yeah, thank you. These are all great questions. And I think also what's really nice is that this is a great time to be asking these questions and to be thinking about these things. I think for most of us, we found ourselves at the beginning of COVID-19 kind of scrambling a little bit for the tools that you're talking about for really being able to listen. There were some things in place and planning had been done, but we were not as ready as we might have wanted to be for this kind of listening. So I think it's important, as Sarah mentioned, to make the most of existing structures in any emergency, but also now is the time in terms of preparedness and readiness to put things in place for listening. And that might be hotlines, as Sarah mentioned. That's a great way to really find out what are people asking about, what are their concerns. You can just do simple monitoring of disease-focused hotlines. But social media, as the second question really focused on, it did become a nightmare, and yet it's also a real tool that could be used, and we all used it. Even as WHO, we're also sharing messages, and it's such an important channel to be used. So we need to think of it and be aware of it in all the different ways that it is being used. And there's been a lot of work done by WHO and many others around the social media monitoring, so we can kind of understand more of what's the general kind of sentiment. That's a way of listening to people, and how to then respond to that. And there are a number of different ways. That's maybe even a training. So I would say that social media can definitely be a tool that can be used for good or not. So important to consider a lot of different ways of working with that. And important to think about now for your governments, putting in place some mechanisms for really listening to people. And that might be community meetings and other ways of really linking individual people, users of your health systems, to decision makers. That's what we really wanted. And that was something that for most places was kind of missing at the peak of COVID-19. So what that might look like for your country, will be different in different countries, but now's a great time to really think about creating those mechanisms so that they're in place and people are used to using them when there's an emergency.
Thank you very much, Martha.
Just to add a few things to what Martha and Sarah have just been saying now. I think that just one of the things that is worth also doing is just thinking with the existing mechanisms that you have, whose voices are being heard.
Nina, I think we lost you. I think you muted. So for some reason.
What I was saying is that through the mechanisms that you are using, whether it's social media or it's important to think about whose voices are being heard, and also then whose voices are not being heard. And so to think proactively about engaging some groups whose voices might not typically be heard in sort of more public spaces. Thanks, over.
Thank you, Nina. La colega de Costa Rica un poco nos dice a qué maneras de hacer sistemáticamente la recolección de datos de Facebook, y yo ahí quisiera aportar.
Can we
Hay
collect
muchas plataformas que hacen recolección sistemática de
data
redes
from
sociales.
Facebook?
Hay algunas
Yes,
que
I
son más
know
caras
that
que
there
otras.
are
De hecho, hay algunas
some
versiones
areas
gratuitas.
and mechanisms to
Muchos
collect
países han
data
ensayado
from the
con,
social
por
media.
ejemplo, les
Many
pongo un
countries
ejemplo del Hootsuite, que es algo que se usa mucho,
has
que recolecta
used Hootsuite
sistemáticamente y monitorea hashtags en redes sociales,
to
incluyendo
monitor
Facebook, pero hay
hashtags
otras
in the
como
social media.
TalkWalker, hay otras como Google Alerts que tienen
Google
también una
Alert,
versión
and other
gratuita.
mechanisms.
Entonces, hay muchas plataformas.
There are many
Los servicios
platforms.
básicos no suelen ser tan caros, pero cuando
Basic
queremos
services are
servicios
not so
hechos a la
expensive.
medida de
But
las
when we
necesidades de la
have
autoridad
tailor-made
nacional, ahí es cuando digamos
mechanisms
que
for
ese
national
costo
authorities, I
empieza
think the cost
digamos, a crecer.
begins
Pero
to
hay otras
increase.
herramientas,
But
si
there
no las
are
tienen,
other
con las que
tools,
podrían
and
empezar, y el
if you
propio
don't have them, Facebook
tiene
itself
herramientas de
has
monitoreo
tools for
sistemático de datos.
systematic monitoring of
Si ustedes
data.
tienen una cuenta
And if
de
you
grupo
have a
de Facebook
Facebook
o
account,
página de Facebook
or if you
oficial de
have
su
an
autoridad de salud,
official
esa
Facebook
página
page
les
for
da
your
unas
health
herramientas
authority,
gratuitas de
that
monitoreo
page
o de
gives you
escucha social
free tools for
dentro de
monitoring and for
Facebook.
social
Entonces, sí
listening
es
within
cuestión de
Facebook.
pronto
So it is
asesorarse
a matter
con personas que
of
trabajen
asking
el
people
tema
who
de redes
work
sociales,
in
mercadeo
these
en redes sociales,
topics and
para ver
this
cuál sería la opción
marketing in
más
social media to
digamos,
see
adaptable
which would be
sus
more
necesidades,
adaptable
y
to your
ver qué costo
needs,
tendría,
and
qué
then
se puede
what the
hacer con las
cost would
versiones
be, what
gratuitas.
can you
Y hoy en
do
día
with the free
los profesionales que
services,
trabajan en community
and
management
work
de
with
digital son
professionals
muy
in
expertos
digital
en
community
este tipo de
management
temas, y
because
su
they are the
asesoría es muy
experts
importante
in this topic. So I think this is
para poder
important
definir qué herramienta es
to
la que
be
vamos
able
a
to
usar.
define the type of tools
Quisiera
that you
pasar a
will need.
otra pregunta
And
que nos
now
hicieron
there's
desde
another
Perú.
question from Peru.
Dice, y es algo con lo que todos estamos
This is something
luchando en este momento de fatiga
with
de
which
medidas de salud
we are
pública.
right now
Dice, durante el
working. It
inicio de la
says during the
emergencia, la
beginning of the
población
emergency, the
adopta las
population
recomendaciones,
adopts
pero al
or
pasar el
adopted
tiempo las va dejando.
recommendations, but as
¿Cómo
time
hacer
goes
para que
by,
sean más
that
sostenibles
population
en el
does
tema de
not
la
pay attention
aplicación de
to
las
those
medidas de salud
recommendations? How
pública?
can we make
No
this
sé
more
quién de las
sustainable?
tres
I don't know which one of the three
quiere aportar
speakers
a
would like
esta
to answer
respuesta.
this.
If not, I'll pick Sara. You can go ahead, and then Marta.
I spoke about that in my presentation. I would like to hear from Marta and Nina so I can get some other ideas, and then I can come in, but I'd like to hear them first.
Marta, please, you can go ahead.
I would say, really emphasizing what Nina mentioned before, it's very important to keep in mind who are you hearing from and who are you not. We know Facebook, even though it seems like everyone is on Facebook, it's really not everyone. And so really keeping that in mind, and that it's different in different countries, of course, but looking at who is not being included in some of those kind of surveys or the data that you might collect through Facebook. And that the Facebook information can be extremely useful also, but don't forget that not everyone is in that space. Not everyone is answering those kind of questions. And then, so I think it is important to understand more when you have maybe a specific population or groups of people who are not following recommended behaviors. You really need to understand more about who are these people and why are they not doing what you would like to see them do. And I think some kind of research or data collection is really important for that. It does not necessarily have to be an extremely complicated academic kind of research, but something where you're really targeting and really speaking with the people whose behavior you want to change, because we can only help people change their behavior if we understand the behaviors that they have now and what they consider barriers or drivers to the behavior we would like to see them do. And then you can work to put some kind of communication or other kind of interventions into place. And it's important to remember also, information and communication is not the only thing that helps people change their behavior. People may have information already, they may understand the situation, and there may be other reasons why they're not actually changing their behavior or doing the thing we want them to do. That might be around access to services, other kind of perceived barriers that they have, other real barriers that can be changed. So understanding in a really direct, targeted way what's going on for those people is important.
Yeah, excellent points. And I think that these are such important questions to be asking now, because, as Martha said, now is the time to start thinking about how would you do this in your particular context, in your, in your countries. What kinds of mechanisms do you currently have in place and have access to, and how can you negotiate access to mechanisms if you don't feel that you have a sufficiently representative enough mechanisms that will give you access, particularly to some of the lesser heard voices. So what community groups are important to engage with and to establish links and networks with, and how might you do that? And the more that you can be thinking through that process now, and setting up structures, the better. This is the preparedness work. This is the work that we really need to be doing now, to be able to do strong RCCE in future emergencies. But again, I also want to just make a final plug for the importance of data. So important. To be able to rapidly collect the information, because that's where you start to bring in the systematic and rigorous approach. That's where you can start to look to see who have we heard from, who have we not heard from, and from the groups that we've not heard from, how do we access them? That might need a different approach. It might need smaller qualitative studies. You might need to know who are key people who are trusted in different communities that could do rapid qualitative studies in the event of an emergency. So the more you set up those networks and infrastructures, the better. Okay.
Okay.
Martha wants to add something, I think.
Could I add something? Sorry, I just have a recent example. I was just speaking to someone in one of the countries in Europe. I wanted to share for everyone on this call. It's one of the countries that had not had a lot of diversity in their population until more recently. And they found during COVID, they just realized in the Institute of Public Health at that time, in the middle of COVID, they did not have a way of really hearing from these communities. They were developing messages, they were moving forward kind of in the way they always had, and were not seeing the results that they had hoped for. And then realized, they really didn't know what was going on for a lot of the population. And they said through some personal relationships and others, there was maybe a researcher or someone in the Institute of Public Health who had access to, they were able to get some of that information, but they realized in that peak crisis time, they didn't have the structure for that. And they're really back now and looking at how can we build that? How can we have an ongoing conversation, entry points, and really a way of accessing two-way communication with people who are not traditionally part of our decision-making process. So it really is something that so many countries all over the world are, learning from COVID and trying to put these structures in place now.
Solo quería añadir, Tania, una cosita que es...
Tanya, I just wanted to add something, and it's that recently I was working with a country for 2 years. So that's since the beginning of the pandemic. So I was able to be a part of their efforts during the entire process, from the peaks to what you were just saying. They were telling me they were so tired of saying the same things over and over. And the data collection and social listening mechanisms were really complicated. So given my field experience, what would I recommend? What can be done at a practical level? So it's important to have routine mechanisms that are going to support us in an emergency. We're always asking what to do during the emergency, but if we already have established connections in advance, it will be much easier for the community to listen. Even if I'm not in a position to gather data or set up mechanisms in some countries, especially those that have very bureaucratic systems, still we can access information that's in the social media. It's an easy way, it's a free way to access the community. Other channels can be much more complicated, more bureaucratic. So if we do this routinely, it will be much easier when there is an emergency. It's will be easier to be interlocutors because we will have credibility. So we need to start working now, especially at the national level, to build trust routinely. How can we make sure that people know what the health situation is, whether or not there is an emergency, and what they would like to hear from us, the institutions that are there to support them? And I think having that type of engagement is going to change things. People will know us, and in the future, they will be ready to trust us.
Muchísimas gracias, Sara. And
Thank you very
a
much,
lot,
Sarah.
Marta and Nina. We really appreciate your time. We ran out of time for the questions, and we're going to move on to the exercise of today's webinar. But I really want to thank you, all your flexibility and all the accommodations you made to contribute and participate. I really think is key, and I hope that we can continue to collaborate from the Americas with you. Thank you very much.
Thank you. Absolute pleasure to be with you. Enjoy
Yes.
the webinar.
Thanks so much, everyone. Bye.
Tania, ahora pues llega el momento del ejercicio.
Tanya, so now it's time for our exercise, and I think you're going to be guiding us.
Sí, vamos a iniciar el ejercicio.
Yes, we're
Unas
ready to start the
apreciaciones iniciales
exercise.
antes de que Sara de pronto también
I
me
just have a
complemente con
few
algunas
instructions
indicaciones
before
específicas.
Sarah
El ejercicio del día de hoy es individual,
takes
no hay
over.
necesidad de
Today's
tener grupos.
exercise is an individual
Tienen, no
exercise. You don't have to
necesariamente,
go
y
to
este
the
webinar el día
breakout
de hoy
rooms.
termina a las 11.
The
Entonces les
webinar
vamos a
will be
dar,
ending
me
at
pareció muy
11.
importante que tuviéramos la
So I
sesión de
thought it was
intercambio
important
porque
for us to
pudieron
have an
salir
exchange
preguntas muy claves para todos los que trabajamos en esto.
because we've heard
Pero no se
questions that I think are
sientan
very
con la
important for
presión de
all
que
of
lo tienen que
us.
entregar antes de las
But
11.
don't
Es
feel
decir, lo
pressured
pueden
to
hacer
hand
en
this
su
in
tiempo y
before
si lo quieren
11.
terminar hoy
You
más
can take
tarde,
your time and
con
send it to
muchísimo
us
gusto vamos a estar
later.
recibiendo
That would be
las preguntas y
absolutely
realmente es un
fine.
ejercicio para
And
que tengan un
the
primer
point of
contacto
this
quienes no lo han
exercise
tenido
is for
con la
those of you
estructura
who
de un
have not
SOCO, que es
yet had any
que
contact
tiene
with
esta sigla en inglés,
SOCO.
que es el Single Overarching
That's the
Communications
acronym in
Objective,
English,
y como lo vemos
Single
aquí en
Overarching
pantalla, el
Communications
resultado
Outcome.
único y global de
And you can
comunicación
see the
por sus
Spanish
siglas en inglés.
translation, even
Y
though we
realmente
still
es
use
una
the
primera
acronym
exposición
in
a cómo
English.
trabajar un
So it's a
mensaje
first
y la
exposure
armonización de los
on how
mensajes
to develop a
dependiendo
message
de
and
la
how to
información
target
técnica que
a
tenemos,
message
de la
based on the
información que
technical
tenemos
data we
también del
have,
terreno, de lo que
also
estamos
based
viendo
on the
de
experience we
comportamiento y de
gather
pronto de
from
la
the
adopción de
field,
medidas de salud pública, si
what we're
queremos
seeing
basarnos un poco en eso.
based on the public health
Y les
situation. So that would be
invitamos
the basis.
digamos, a realizar el
And
ejercicio.
we
Como
invite you
les comento, si lo quieren contestar
to
en su
participate in the
tiempo y
exercise. You can take your
regresar a
time
la
to answer the
sala antes
questions,
que
and
den,
we ask
digamos
that you
que
please
en
come
unos
back
5 minutos antes que den las 11 hora de
5 minutes
Washington,
before we
D.C.,
close, so
que
at
es la hora en la que
10:55,
estoy yo, por
because
eso
we
digo
will be
11.
wrapping up
Aquí
at
son las 10:41,
11 Washington time.
entonces ahí para que lo
So it's
tengan
10:41
en mente.
here, just to give you an
Y Sara,
idea.
no sé si quieres entrar a complementar un
And
poco. Ahí ya
Sarah
tienen todos el
will
link
be
en el chat.
adding
Pero Sara, no sé si quieres
some
complementar
instructions.
alguna
The link is in the chat,
información.
but Sarah, if you want to
Tengo
add
aquí la
anything
presentación
at this
abierta
point, please
y
go
la
ahead.
podría empezar a mostrar, pero como tenemos tiempo corto para que inicie,
Since
no
we
sé si
have very
quieras
little
complementar
time,
con algo muy puntual.
I would like to ask Sarah if she has anything she'd like to add. I just wanted to recommend that you think of the type of situation for which you would be developing a SOCO. As our colleague from Peru said, it's important to know who is listening to us, and it's important to think of the problems you're facing now and what changes you need to put in place. So we have an open situation. You will be developing the SOCO to bring about a behavioral change in whatever context you are considering. That's the only thing I would add. So think of a situation you want to change and then develop your
Y
SOCO
este es un
for that.
ejercicio que sirve
so that
mucho para
leaves it
comunicar ciencia, que muchas veces
open-ended.
nos cuesta tanto trabajo. Entonces, hacer esa traducción de
It's
los datos
important to think that
científicos,
we're
de los datos de
communicating
salud
scientific
pública,
information, scientific
hacia la
data.
población en
So how
general,
do
que es
we
donde a veces nos
translate
cuesta un
that
poco de trabajo.
for a
Este
general
ejercicio
audience?
es un primer paso a
So this is a
ayudar a
first
ordenar
step
un poco la
to
información
help
y a decantarla
organize the
para poder
information
comunicar
and
externamente al
to
público.
break it
Entonces, los
down
invitamos a que
for the
tengan
audience. So
este tiempito, digamos que
we
unos 15
encourage you to take
minutos
this time.
y
You have
regresar
about
aquí al
15
plenario
minutes
para
to
cerrar
do
y
this and
tendremos
then come
algunos
back
mensajes
for the
finales
plenary so
importantes
that we
para
can wrap up
ustedes.
with a few key messages for you.
Nos preguntan que si podemos compartir el enlace, ya lo voy a poner de nuevo en el
We
chat
are being asked to share the link. I'm going
para
to be
que
putting it
puedan
up
acceder al ejercicio.
in the chat so that you can all access the exercise.
Aquí en Washington, D.C.,
It is
5 minutos
10:55.
antes de las 11, quisiera pasar un poco a los
So in order
mensajes
to finish before
finales de este
11,
webinar de 3 días,
I'd like
haciendo de
to
nuevo
go into the
la
wrap-up of
claridad,
this
dándoles la
3-day
orientación que no es necesario
webinar.
que hayan terminado o que terminen el ejercicio en este momento. Tienen
And
este link está
please
abierto
don't
para
feel
cuando
that you have to
ustedes puedan
finish
tener ese
the
momento de
exercise right
reflexión
now.
y revisar las
You can take your
presentaciones que
time to
acompañan las
finish,
instrucciones del ejercicio
review your
y contestar
answers
un poco las preguntas, al igual que los
to the
ejercicios que
questions,
tuvimos en el día 1 y en el día 2.
and you will,
No hay respuestas incorrectas.
like
Realmente
as
lo que
in
queremos
days 1 and 2, in those
generar es una
exercises, there's no right or
reflexión, un
wrong
proceso
answers.
interno de enfoque
We will be
hacia
using this
un objetivo
information
de comunicación única o
in-house,
SOCO, que se llama normalmente
and
en la comunicación,
we
para
will
comunicar
be
la ciencia, para
focusing on how
comunicar medidas
SOCO
de
can be
salud
used to
pública,
communicate
para
scientific
enfatizar
information
comportamientos
to
preventivos
audiences,
o
to
adopción
encourage
adaptación o adopción de nuevos
preventive
comportamientos
behavior
preventivos ante una
or
cierta amenaza o evento de
behavior
emergencia de
that
salud pública.
is adaptive
Con este
to
día
public
terminamos.
health
Quisiera
threats.
recordarles a todos
As
que
we
vamos a tener en un
finish
link de la
today,
página web de OPS que
I'd like
estarán
to remind
recibiendo
you
la
that
próxima semana
on PAHO's
toda la
website,
información que hemos tenido en
we
estas
will
3
be
jornadas,
posting
incluyendo
all
las
the information
presentaciones
For the past
incluyendo
3
las
days,
traducciones de las
meaning the
presentaciones, los
presentations, the
videos de las
translated versions,
presentaciones,
also the
también
videos,
las agendas de cada día las
the
vamos a
agendas for
agrupar
each day.
en un vínculo abierto en la
There
página
will
web
be an
de la
open link
Organización Panamericana de la Salud.
on the Pan
Sin
American
embargo,
Health
hoy les
Organization's
estuvimos
website.
compartiendo en el chat un link a un Drive, que es una página,
In the chat
digamos,
today,
mientras
we
hacemos todo el
posted a
setup de
link
la
to a
página
OneDrive
pública que
page.
tendremos la próxima semana. Le pido a mi colega Jimena
All the
Terrazas que les
information will
vuelva a
be there
poner
by
el chat
next week.
del Drive que tenemos momentáneamente con los materiales que no están
We also
traducidos
have a drive
todavía,
that's
pero que
open now.
iniciaremos la traducción para que ustedes puedan
It
tener
has the
toda la
untranslated
información a
materials,
la que nos estuvimos remitiendo
but
en
at least
estos
it
3
gives you
días.
quick access to all the
También
information we have
quisiera de pronto
received
aprovechar
over
esta
the past 3
oportunidad
days.
para
I'd
comentarles
like
que
to
desde el
take this
Departamento de
opportunity to
Emergencias en
say that
Salud,
the Health
la intención del
Emergency
equipo de comunicación de
Department
riesgo, de los
and the
equipos
Risk
técnicos, como es
Communications
la
team
unidad de gestión de
and the
amenazas
technical
infecciosas,
teams, like the
la
Infectious
unidad de
Disease
preparación de
Unit,
países.
the
La
Country
intención es este
Preparedness
año
Unit,
llevar este
are
evento,
planning
digamos, una adaptación de este evento de forma
to
presencial a
adapt
los
this event
países,
and
y
hold
ese
it
será
in
el caso,
person
y ya van a
in
empezar a
countries.
recibir la
You will
comunicación.
be receiving
El primero que vamos a tener va
information
a
about
ser
this.
en
The
la
first
subregión de
one
Centroamérica.
will be in the Central American
Y muy
subregion.
prontamente muchos de ustedes recibirán esa
Very
comunicación.
soon of you will be
Ese taller
notified
será a finales de
soon.
marzo de este año.
It
Y
will be at
luego
the end of
nuestra
March
intención es
of this year.
continuar con una
And
metodología
we plan
subregional
to
presencial
continue working
para
in
Sudamérica y
person,
luego también para el
sub-regionally,
Caribe.
first in South
Entonces,
America
este
and then in the
2023 será la
Caribbean.
oportunidad de, digamos, queríamos abrir este espacio para
So we
iniciar
wanted
con
to
un
start
primer
off
contacto y una primer sensibilización en
with
línea,
this first
pero la intención
encounter
es que podamos
online,
tener estas reuniones
but the idea is
presenciales
to hold
desde
these
la
meetings in
OPS
person
en lo que va a transcurrir del 2023
during
en
2023,
grupos de países.
and we will do it
Entonces, con ese mensaje y
with
esa
a
buena
country
noticia,
group approach.
les dejo. Quisiera cerrar,
So that
agradecerles a
is
todos de
my
nuevo
closing
su
message. I
participación
thank all of you
y
for your
invitarlos a
participation,
que pues,
and
revisen su correo la próxima
I
semana,
invite
porque les
you
llegará la
to look
información que
at your
acabo de
emails
mencionar
next week.
con el vínculo y las
You'll
grabaciones,
be receiving the
además de una
link and the
encuesta para
recordings in
valorar
addition
un
to
poco el
a
contenido
survey.
de este curso y que
We'll
tengan
be
la
asking you to
oportunidad de
evaluate
dar
the
una
webinar's
retroalimentación.
content, and
Entonces,
that information will
muchísimas
be very
gracias por
useful
su
to us
asistencia
as feedback.
y
So thank you again for
quedamos en
attending,
contacto prontamente.
and we will be in touch
Andrea,
soon.
no sé si quieres
Andrea,
dar un saludo
do you
final.
want to say anything? No, that's it for me too. Thank you. Thank you, Tanya, for all your support. I would invite you to turn on your cameras if you can, and would like to say thank you. Thanks, Sarah. Thanks, Liane. Thanks, Jimena. Thanks, everyone.
Muchas gracias.
Gracias, hasta luego.
Gracias a todos, hasta luego.
Gracias a todos, gracias. Desde
Thank
Honduras,
you.
saludos.
Gracias.
Muchas gracias, saludos a todos. Buen día.
Muchas gracias. Muchas gracias, Sara.
Muchas gracias.
Gracias.
Gracias, hasta luego.
Hasta luego.